I'm Dr. Tom Noren, Chief Medical Officer of Marquette General Health System, and you're watching the Improving Your Health series. I'm joined today by Dr. Kevin Piggott, Medical Director of Community Health at Marquette General Health System. Thanks for being with us, Doctor.
Thank you.
How common is the use of tobacco products in our population?
In the U.S. and Michigan, it still is about 1 in 5 people, and that represents 45 million people across the U.S. In Marquette County, we actually had decreased that rate to 1 in 7 by 2003, but unfortunately, steadily since then, we've increased to slightly above both state and national averages.
Are there health care costs associated with the use of tobacco?
I usually look at the cost really in lives and in illness. When we look at that, yes, we know 443,000 deaths can be attributed to the use of tobacco each year. And of those, for every one person that dies, we know that there's another 20 people that are suffering from a chronic illness as a result.
For something that can be so deleterious to health care and well-being, why do people use tobacco?
It's a great question. We know there's nothing essential about tobacco in human life, unlike air, food, water. But for many social reasons, people bring or develop the habit for smoking, chewing, etc. Once they do so, they become addicted to the nicotine. And following this addiction, then we continue to have that craving and desire to utilize the product.
Are there consequences to using tobacco products?
Yes, unfortunately, we know there's many health consequences, but primarily we can look at heart disease. We know that cancers, we know that strokes, we know that lung disease are all related. And those are numbers 1, 2, 3, and 4 in the leading causes of death across the U.S. And that's why we believe that the use of tobacco is the #1 actual cause of death.
So if somebody says, okay, I want to quit this habit, what do they do?
It's a great question. And first and foremost is the desire to want to quit. And I would encourage anybody that does want to quit to discuss this with their health professional. The most successful means usually combines both behavioral means and medication. When we discuss behavioral means, that's counseling, and that can be with your physician or other healthcare professional. It also can be on the phone lines, such as the 1-800-QUIT-NOW. There's also internet resources that people can utilize. When we talk about medications, nicotine replacements, #1, and that comes as gum, lozenge, inhaler, patches. There's also 2 other medications that can be prescribed and will reduce cravings.
Thank you. I've been speaking with Dr. Kevin Piggott. For more information, please visit the mgh.org website. Together, we are improving your health.